Everyone Included is a vision for the future of healthcare based on a framework of mutual respect and inclusivity. We believe everyone should be respected for the expertise they can bring to discussions about the future of healthcare. Here are some of our stories.
Well, thanks guys for joining us. So we have a little challenge, which is that about 1 in 5 clinicians say that they're moderately or very familiar with what clinical effectiveness research is. So why is it that there's this lack of awareness about what clinical effectiveness research is? And how might we create a better way to bring awareness and bring that into the curriculum so that medical students, that clinicians understand what patient-centered outcomes research is, understand what comparative effectiveness research is, in ways to partner with patients more effectively to make better decisions together. Maybe I'll just put that out there as the first question for the group. Is this even a problem?
I think part of the reason is that people don't even think it is an issue. Like, even if they may have heard of it, they may have been from a culture or that was in maybe a certain part of their school structure that they just thought that this maybe wasn't an important part of the delivery of healthcare. And so it's almost like we have to reverse time to shift people's thought process. Before we can even decide what the solution is, we have to know that this is a problem.
Would there be people that say we don't have a problem because patients really don't need to be part of the decision-making process? Leliani.
Yeah, I think I was just thinking through a good answer to that. There would be a lot of people who say it's not a problem because based on the traditional structure of rating physicians as a cohort sort of internally. Whereas from the patient side, I mean, there have been times in my experience where I've seen a physician ranked very highly among his peers, even among clinical outcomes. And I've looked at the list and gone, I would never see that physician again because I completely felt condescended to, or like I wasn't included in the process of what my patient trajectory should look like. I feel like there's such a lack of patient experience with those physicians because I think the term compliance is thrown out a lot, and that itself isn't even delved into. Is it lack of compliance by lack of understanding? Well, that can often be a fault of the physician for not properly educating. I think there's just this void that we're not tapping into that could better help.
There was a research study that was funded by Patient-Centered Outcomes Research Institute through UPenn that showed that physicians were fearful of engaging in those conversations with their patients because they were afraid that the patients would disagree with them and try to follow a path that wasn't clinically sound. And they actually found in the study that those fears weren't necessarily warranted. It's that sense of fear in the clinical setting, especially with primary care physicians who might only have 3 to 5 minutes to speak with their patient. They're afraid they might not have enough time to have a conversation.
I think too that lack of awareness of what clinical effectiveness research is, it's science that's designed to compare 2 treatments to help patients decide which treatment is best for them. Historically, medical research has been driven by outcomes that matter to researchers. For cancer research, it's been a lot about survival rates. When you talk to patients, I think many of them also care about quality of life. And there hasn't been as much research on those aspects of care and treatment. Yet, when we as clinicians make recommendations, we will base it primarily on that one thing. And I think that's where patient-centered outcomes research comes in, because then our outcomes are more centered around including what patients want the outcomes to be, and also the comparative effectiveness research, or trying to generate science to compare different treatments so that both the clinician and the patient can make better decisions together.
And I think this issue is going to grow because medicine is becoming more and more complex every day. For a physician, it's going to be more and more difficult to understand all the issues that are involved with one patient. And on the other side, information is flowing freely for patients to gather on the PCOR website or other websites, and they become almost as knowledgeable as a physician. I think they're going to become more and more involved in the decision process.
I think maybe a better way to think about it would be where the incentives are aligned. And so even bringing it back as far as your medical education, for some students, the incentives are very much getting high scores and then getting into a good residency program and then from there on succeeding as a physician. If the curriculum, for example, does not emphasize PCOR, CER, or does not involve it at all, there's not really an incentive to go out and seek that information and integrate it into their thoughts and their practice. And so for other people, their incentive may be, I want to be a doctor that involves patients, how can I do that? But how easy is it for them to find that information if they aren't exposed to these ideas in their everyday classrooms and able to practice with it and interact with it? It's not necessarily they don't want to, but the incentives or the opportunities or the accessibility isn't there.
Is there anyone at this table who feels like patients should not be involved? Can we think of any argument against it?
Just playing devil's advocate to your question, like I was just talking with some device manufacturers about how, I as the patient, I want my data, and the device manufacturers are like, well, we're kind of afraid to give it to you because then we're going to overburden the physicians, and we already are seeing such high physician burnout. I think that's a mostly unfounded fear because I think by empowering the patient, you're often bringing them up as a peer level, and there's less the physician has to do at the end of the day.
What I like to think about is how do we shape those tools to facilitate those types of interactions? Like you and I have talked about this, about the flow of information and how that's structured. So, for example, in the context of a patient-provider interaction, for the first time, the patient with some type of chronic condition, maybe they have a high school education at best. If there was some type of visual tool to help them designate what their priorities are, those other types of tools or designed interfaces to facilitate that flow of conversation so that everybody's on the same level.
Well, some clinicians might feel like the patient just can't ascertain the amount of knowledge necessary to really understand maybe the full weight of certain decisions, and that with their amount of knowledge and background or experience that they can essentially make that decision for the patient. I think what it stops short in is not recognizing that just because maybe a specific resource that maybe you're not aware of or doesn't exist to potentially educate that patient into making a better informed decision doesn't mean that we can't then generate that resource in the first place.
With patients who might have misconceptions on certain topics, I would say vaccination, to use as an example, how can you deal with them if you fail to educate them? The misconceptions are very strong and you can't manage to override these misconceptions.
I've heard several words used in the discussion lately. I've heard Leliani say elevate the patient. I've heard Justin say level. I think that is acknowledging inherently that there are imbalances in power in the relationship. And just as much as we say patients don't understand or might not understand the medical science, do we as clinicians understand our patients? And do we need to be educated? What we typically don't realize or acknowledge, I think, is clinician engagement. We also talk about patient engagement. We don't acknowledge that there's enough about clinician engagement. I wish I had an answer for you, Remi, but I would start with saying, how can I get smarter and understand my patient better? I think that's part of the idea behind this leveling or bringing everyone to the same level, is to say that we're in this together and no one's better than anyone else. Maybe that's a component that's also missing from the culture. Is this idea that we all have something to learn from each other.